Hi, it's Adrian from Advanced Dental Artistry. Single teeth implants or replacing a single tooth. There are two types of single teeth that we replace, of course, back teeth and front teeth. When it comes to back teeth, we know that a lot of people do lose molar teeth, and the one that they normally lose is actually the first molar. The first molar actually comes through at the age of 5 or 6, so it's actually our first permanent tooth. And of course, as we age, we use this tooth a lot. It does a lot of our chewing for us. So we find that it usually has restorations placed. It usually can sometimes fracture or break or need root canal treatment. And in some instances, it does get extracted. In the instances where any tooth is extracted, one of the problems we see is bone loss. And the bone shrinks, whether a top or bottom molar tooth, the bone will shrink once the tooth is actually removed. The main issues we have is on a lower tooth, as the bone shrinks, it actually shrinks and gets closer to a nerve that runs in the lower jaw. And it's this nerve that needs to be avoided if we're placing implants so that we don't touch or damage this nerve. On the upper, we have also a different problem where as it shrinks, it of course gets closer to the sinuses. And this is an air pocket. So as the bone shrinks, you get less and less bone, and it makes implant placement much harder. So if we do find that there's a delay between having the tooth out and having the implant placed, and sometimes it can be decades, it is very common for us to need to bone graft the area in order to augment the bone so that we can place an implant and avoid these two areas. A front tooth that is missing, well, most of the cases when we see a front tooth has been missing, it's actually due to trauma. So the patient had a knock or a fall, or maybe a sporting accident. They may have had the tooth for a while, maybe it's gone through root canals, maybe it's actually got a secondary infection or it's fractured, and these teeth need to come out. Ideally, if a tooth needs to come out, we'd like to place the implant at the time of removing the tooth. And actually it's even better to not only place the implant but the final abutment, because the soft tissue actually responds much better if the final abutment is placed during surgery also. So if a tooth is going to be removed and the tooth is still there, it's very important that the implant gets placed at the time of removing the tooth. In those instances where the tooth has been lost for many years and maybe the patient has had a partial bridge or a partial denture to replace the tooth, the issue of course is going to be that bone and gum loss. And unfortunately, the bone and the gum will shrink very rapidly around the front tooth. If we are actually considering replacing the tooth with a dental implant, in most of these cases we have to graft bone and soft tissue to make it ideal before we place a dental implant. If you have any questions, please give us a ring at 100 Smiling. We have many cases actually on our website when it comes to implant replacement, whether a back teeth, a front teeth, or replacing all of the teeth. I look forward to one day seeing you in the practice.